And this is a picture showing folliculitis and abscess, carbuncle and impetigo. Here you can see the pus pointing, folliculitis, infection of the hair follicles, and abscess, this is tender swelling with collection of pus inside that, and carbuncle, this is again as a deeper subcutaneous infection. It's multiple furuncles together, it causes a deepened infection, deepened subcutaneous infection. This is called carbuncle, and these are sores seen around the mouth of the child, and this is a honey colored crust is seen. And next is musculoskeletal infections, that is septic arthritis involving knee joints, shoulder joints and all, and osteomyelitis. Vertebra is involved in adults and long bones in children, and pyomyositis and skeletal muscle infections, and abscess, of course epidural abscess. Okay, so all these kind of infections can be caused by Staphylococcus aureus. And next is respiratory tract infections, that is VAP, that ventilated associated pneumonia in adults. Patients on mechanical ventilation can develop VAP, and septic pulmonary emboli, and post-viral pneumonia, empyema, pneumothorax and pneumatococcus. These are some of the respiratory tract infections caused by Staphylococcus aureus. And urinary tract infection, usually staphylococcal UTI and pyelonephritis can occur secondary to bacteremia. And also following instrumentation or catheter insertion, the UTI following this kind of instrumentation or catheter insertion is found to be very rare. And bacteremia and other complications like sepsis, patients can undergo develop sepsis and septic shock. And CLABSI. CLABSI is nothing but central line associated bloodstream infection. That is, patient on central line can develop bloodstream infection due to this, can be line associated, and the causative agent could be Staphylococcus aureus. And metastatic foci of infection involving kidney, lungs, bone and joint as well, and infective endocarditis. So all these complications can be caused by Staphylococcus aureus. And of course, toxin mediated illnesses include TSS, which we have seen in detail about toxic shock syndrome, food poisoning, and also Staphylococcus scalded skin syndrome. Okay, these are toxin mediated illnesses. And infections associated with community associated methicillin resistant Staphylococcus aureus, that is CAMRSA. Necrotizing pneumonia, sepsis with Waterhouse-Friderichsen syndrome, that is purpura fulminans, and necrotizing fasciitis. So all these are caused by, can be caused by Staphylococcus aureus.